Morale is low. You're working with somebody that you have to train for a couple of days, but they're making double or triple what you're making.
Crystal Sims Murphy is a nurse practitioner at Jacobi Hospital, where she says her staff is spread thin and going through a rotating door of nurses.
We're training nurses that are coming fresh out of school for 3 months, 6 months, a year, and then they leave because they can get a higher pay.
Nurses at city hospitals are currently negotiating a new contract with health and hospitals. They want to match the pay of private hospitals, where nurses went on strike earlier this year to secure higher pay and better benefits with a more manageable nurse-to-patient ratio. But nurses who work for city-run hospitals don't have the option of joining a picket line.
Because of the Taylor law, if we strike as civil servants, we could lose our jobs.
The nurses union turned to the city council for help to understand the hospital's budget for hiring traveling nurses at a higher pay to fill staffing gaps. They say Jacobi Hospital has seen the worst attrition, losing 189 nurses in just 10 months.
We have over 10% of our nurses leaving our city. That's not acceptable. It's a slap in the face, and we cannot continue doing that. We need to hire locally.
The cost of maintaining sufficient nursing has put us in a negative net balance. So we are currently anticipating a loss of $144 million in fiscal year 2023, which is about 1%.
The head of the city's health and hospital said he agrees attrition of nurses after COVID has been an obstacle for keeping safe nurse-to-patient ratios. They said their goal is to use less traveling nurses this year by hiring more full-time staff. But staff nurses still have one big concern looming.
If you're spending all this money on agency staff, why can't you spend that money on the staff that's loyal and has been there for so long by giving us equal pay?
The nurses union has given health and hospitals a deadline of June 1st to agree upon a contract. Their next time at the negotiating table is in April.